My name is Jennifer Warne. I'm the Vice President of Physician Services at Ascension St. Agnes. My role and responsibilities include collaboration, partnership within our financial team, our medical team, our physician team, and our staff within our hospitals and ambulatory sites. Providing communication and streamlined processes is a goal of mine, to make sure that we have our staff being able to work smarter, not harder, and being able to minimize the amount of repetitive work that's done and to really streamline our current IT systems and our current EMR record system, being able to also collaborate with Ascension Ministry Corporate to basically become an outreach of the ministry itself. My goal is also to provide feedback and collaboration for our physicians and our senior executive leadership team and be able to bridge the gap between outpatient and hospital operations. One of the main focuses of my role is to increase the ability to care for the patient in and outside the hospital. Increasing the continuity of care before and after a hospitalization, before and after a procedure is very key in our partnership with the hospital. Patients are getting more and more complex, they're sicker, and a lot of times they need to have more than just one provider see them at any given time. Our goal and our vision is for our ambulatory offices to have multiple service lines be in one space that we can accommodate those patients with partnering service lines, for example, pulmonary and cardiology, or oncology and cardiology, or internal medicine and endocrine. These are some of the service lines that we want to be able to increase the outreach without putting too much burden on the service line and increasing physicians if needed. We also want to make sure that we're using a lot of our APP providers to help support and increase access. APP is the proper term for advanced practice providers, and those encompass anyone from PAs to midwives to nurse practitioners. Being able to have these kind of experienced clinical individuals to support our physician allows us to continue to have a one-team group model towards our care of a patient, so it's not relying on one physician, but one service. Healthcare itself is changing overall. Post-COVID, we've seen the ability to very dramatically shift our way of we deliver care to patients, from televisits to virtual visits to seeing patients in remote offices to connecting with patients on and off floors and within different service lines. The ability for us to deliver care we have to be very quick and nimble, and most of all, convenient. Having access, online access, scheduling appointments, getting a hold of your provider is really important for us to increase our access of care. So coming from the Eastern Shore of Maryland, I'm a very community-based person. I believe that care is local and good care should never be for travel. The culture of this institution, of the leadership team, has been the integral reason why I made the switch from a larger corporation to Ascension St. Agnes. Though St. Agnes is a part of a very large health system, the hospital itself has a very personal feel. Everybody knows each other. We all know the check-in desk, we know the security guards, the coffee lady, Miss Gloria. She knows me from another health institution. She recognized me my first day. So I think it's really important when you join an organization that you believe in its mission and values. I chose healthcare for one main reason, a personal reason. My husband, who is the head lacrosse coach at Georgetown, best friend, was killed by a lacrosse ball hitting his chest during a game approximately 22 years ago. It's a condition called commotion cordis. I did my thesis and my research after that was exclusively on looking at preventing sudden cardiac death in athletes. It's something I'm very passionate about. It's something I do in my own time, that we make sure that we support testing in athletes, making sure that any underlying conditions are identified and that their precautions are taken and that they have good care. My personal life, my professional life has always been about taking care of the patient, either taking care of family, taking care of a neighbor, taking care of a friend. But there is a lot of personal reasons why I do what I do. I love helping the patient. I love connecting with the staff. I love making people feel that I'm approachable. I love growing new leaders. I love being able to see a physician take a dream to an operation. I think it's important for us to have similar dreams and partnering. I think that's where teamwork and collaboration becomes so important. There is no I in team, and truly is something that takes both on and off a field, but also within your career. You have to be able to see the vision and support them and allow the experts to drive the decision making, but allow us as administrators to create a guardrail for safety, precautions, operations, budgeting. Those are all very important when it comes to developing healthcare as a whole.